Harm reduction is pretty much self-explanatory. Its primary focus is reducing the harm and negative consequences for people that use drugs, substances, working with people where they are now, rather than insisting on reduction or abstinence. Fundamentally, I see it as a human rights issue. We should recognise that everyone deserves safety and dignity. It is important in Hertfordshire, like it's important everywhere. But I work in Hertfordshire, as Borough Services. I suppose the biggest misconception I come across is that some people believe harm reduction encourages negative or illegal behaviour. I mean, I was asked recently whether I thought giving a person naloxone would mean the person was more inclined to use heroin. I had to explain that not only is there zero evidence to support that, but people are going to use drugs, and naloxone is a medication that saves lives. If the person doesn't have it and they overdose, they might die. When I deliver training to partner agencies, I emphasise that people aren't more likely to use drugs because they have green needles. They're just less likely to share equipment, so they're less likely to transmit BPVs, so less likely to have abscesses, soft tissue infections, etc. The harm reduction policy in the UK began in the 1980s when we first started realising that sterile injecting equipment being distributed to people injecting drugs could slow down the spread of HIV. I was working for CGL, or CRI as we were known then, in 2015 when we started issuing naloxone kits to people using opiates. And now we can issue testing kits to people to check whether their drugs could be contaminated with synthetic drugs like nitazines. I'm proud to say I work in Hertfordshire because we believe in a lot of things nationally. We were one of the first counties to train police to carry naloxone. We were the first and I think still the only CGL service to have naloxone available through NSP Direct, their free postal service, where people can order harm reduction equipment online. Well, that's simple really. It's improving the health and well-being of people that use drugs in Hertfordshire. It's a simple answer. For example, the police using naloxone 23 times in the first 2 years they were carrying it. We've got a street cleaner carrying naloxone in Welwyn Garden City that has used it 9 times whilst doing his job. That's 32 lives saved without even mentioning the numerous times naloxone has been used in hostels by staff or by other professional organisations that are trained and have saved lives. Whilst we have seen a big rise in overdoses over the past 3 years in Hertfordshire, and that's just on the confirmed cases we received, so the real figure is likely to be much higher. Just on these reports, it equates to more than 1 opiate overdose happening every week in Hertfordshire. But the case of opiate overdose related deaths have increased. I think one of the biggest challenges we face is the stigma that surrounds people that use drugs, particularly those that use heroin and crack cocaine. But on the whole, drug use in general, some people still have the opinion that drug use is a choice. It's a health condition that should be treated like one. We've got NSP and all of our hubs. 26 pharmacies that provide needle exchange packs and naloxone on request. We have the NSP Direct Postal Service where people that use drugs can order harm reduction equipment, needles, syringes, pretty much anything harm reduction focused online, with next day Royal Mail recorded delivery, including naloxone and nitazine testing strips. Most importantly, over the past 5 years, I've trained nearly 3,000 professionals in Hertfordshire how to recognise and respond to overdoses induced naloxone. Anything from supporting partner agencies with training, to providing them with naloxone, making sure external agencies know how to access sterile injecting equipment, refer people into treatment and understand the stigma that people using substances face daily. Sending out drug alerts to partner agencies, keeping them updated and building continued relationships. Well, we're still hoping to get naloxone in defibrillators. It was disappointing that the government stepped in and blocked that, but apparently they are looking at it, so who knows. We want to get more street cleaners trained up, to use an example we have as well in Garden City, and hoping we might be able to replicate this in other parts of the county. Also looking into security guards in pubs and shopping centres.